goal out of this is to form a team and to get together and head up there to Santa Fe. And if people can't head up there to Santa Fe, at the very least be aware of how the Health Security Act is moving through the legislature so that they can call their legislators or other legislators and really encourage them to support this.
Over 400,000 New Mexicans are uninsured. Over the last 8 years, premiums have increased 92%. Our median wages have only increased 20%.
It puts families and people who are on low income in deciding whether or not to pay for their copay, their bills, or should I go to the doctor, right? So it creates a culture of not going to the doctor and not being healthy. The private insurance is really controlling the health, right, the cost, and they're in control of everything. We have no way of holding them accountable as to why we have to pay so much.
If you don't have your $5, $15, or $30 copay, then you cannot see the doctor. About a month ago, I had a 10-year-old child that went inside with her aunt in the labor. She was having a baby to do the interpretation at UNMH.
What I like about the Health Security Act is that it lowers the cost for everyone, because now there's not the bureaucracy of having to deal with the numerous amount of insurances that are out there.
Prescription drugs are also included in that plan, as is mental health. Existing doctors and hospitals will remain in place. This is the people's plan. We call it a cooperative. We're all going to have input in terms of how the plan's going to work. There will be public meetings to talk about any changes that might need to be made. We're hoping that we can be the first in the country to pass true universal health care.
What is your anticipated opposition?
Of the insurance industry, and they are a very powerful lobby up at the legislature.
What do you say to someone who says, look, I don't want to pay more money in taxes for people who don't have insurance?
We're not looking at increasing taxes, number one. And number two, we're already paying.
It's very ironic and very interesting that in a society like ours, where we are supposed to be the model for the rest of the world, we cannot take care of our citizens' health problems.
But fundamentally, the private insurance in the market is wrong. It just doesn't work, it doesn't function, because it's all based for profit. It's not about health at all.
The purpose of health security is to improve the service to the community, to help people, to cut down the cost, and to make things better, make the life better.